and bring it down the legs. Then we're going to start on our leg. So if you notice that your person's heel is slightly turned in, what I'm going to do is I'm going to get my hands underneath their thigh and start to turn those inner thigh muscles to spiral them out to help bring the heel more central or slightly out. Oil up the leg. Depending on the underwear, if you can get up into the glutes, then that is wonderful. And include those gluteus muscle, biggest muscle in the body. Okay, so once we've got the oil everywhere, we're going to start with our 3 effleurages, open and close with 3 effleurages. So fingers either side of the calf muscle, thumbs dropping into the center of the calf muscle, and then get your weight behind as you lean into the thigh, the hamstring. And the next one, you can take it slightly in on the calf, skip over the knee, no pressure behind the kneecap. A little bit on the outside. On the third one, coming back up and back down. Good. You can do a little bit in the Achilles if you like. And then we're going to begin claw. So 4 fingers and thumb either side. Come up the belly of the calf muscle, switch over, back down. And just check in to relax your own shoulders, scoop your tailbone, awareness of your own posture, and then you can get into a nice rhythm. Once you've done that a few times, you're happy with that, you can let it branch out into a little petrissage, wild thing, as we just kind of rake those fingers through the muscle, bringing lots of blood flow, flushing the muscle. And then move it into another petrissage, the kneading or the wringing. So that's using the palm to pull up on the muscle, fingers on the other side. And if you can sink your own body down so you can come from your core, shoulders nice and relaxed. Or if you're quite a tall person, you could always go down on one knee if that was better. But just be aware of what's happening in your body. You can do it a couple of times or 3 times. Especially if somebody has done a bit of walking or a bit of sports, always good to give it a bit of extra just to get the fibers all loosened up. Okay, and then you can take it up into the thigh. Same idea, that nice wringing motion, petrissage. Okay, so we're moved up to the thigh. So back of the hand, flat fingers. Aware of when you're using the knuckles, that's very different feeling than when you're using the flat fingers. Unless somebody wants extra pressure, maybe the knuckles, but generally the flat fingers is plenty for majority of people. So I'm going across the hamstring muscles, and you're just stripping up through those muscles. So you're going with the fibers, even into the inner thigh, the abductor muscles. You feel that your person is comfortable with that. You'll know if they're not because they'll twitch or they'll hold their breath. So So just checking that out if you notice anything. Depends on the body comfort of the person and how much massage they've had. So just be aware of that. But if somebody is very comfortable, then it's a shame to miss out on these inner thigh muscles as well. However, if somebody's not comfortable and it would make them feel unrelaxed or unsafe in any way, then better to avoid that area. Make sure that our person is nice and relaxed. Okay, so we're going to do some fingers up along the IT band between the knee and the hip, the connective tissue band. That can be quite tight for people. So just bring the fingers up along there. You might even want to go a little slower. And then you come up and do circles. You'll feel that bony protrusion, greater trochanter, circle between that and the hip. Again, if you get your own body behind it. And then once you've done that, we're going to come into the glute, unless you can't get to the glute due to the underwear. But if you can. So we're going to change our body position. So notice I was at the side and then I've moved up. Change my body position. So I'm more with the fibers of the glute. And again, I'm just using the back of the hand. Yep. Once you've done that, you could go back to this one again if you felt you wanted to do another little bit. And just making your way back down the leg. And then we're going to finish with 3 effleurages. So all that we're doing is nice, pretty much nice and relaxing moves. So we're just doing the same, 3 effleurages that we open the leg with. We're closing with 3 effleurages. Okay, so again, the ankle's slightly in, so I'm just going to put my hands and just draw those inner thighs, spiral them out a little bit to change the position of the heel. So hopefully you caught that. Okay, so if your client's hand is too close to the hip, just feel free to just grab it, take it out, so they don't have to think about it, and you're not going to hit it with your hand. Again, cover the oil the leg. And regarding the oil, just be aware that some people soaks up the oil a lot faster than others, whereas others, yeah, the oil goes a lot further. If they tend to be more of an oily person or a kapha person compared to somebody who's more of a vata body constitution, like myself. Okay, so same idea, 3 effleurages. So you just take it from above the knee to the sit bone. Above the knee to the sit bone, stripping up through the back of the thigh, the hamstring, all the way out to the side, into the IT band. You can do that a couple of times. we do some circles around the hip. So we feel the bone there, and just circling around it into the glute, and then changing my body position to move into the glute. And we'll make our way down, finish with 3 effleurages. They're more our more relaxing moves. Okay, so now that we've done the legs, you can either walk back up or just make your way back up to the back, and then we'll finish with 3 breaths. So taking a nice deep breath. So I've got one hand behind the heart center, one hand behind the sacrum. Feels nice and safe. So you don't want to put the hand under the on the lower back, just because, yeah, I don't advise putting the pressure on the lower back, but it feels nice and safe and comforting to put it on the sacrum and the back of the heart center. Okay, and to turn her over, I'm going to go over the other side so I can be more discreet. I'm going to hold the drape with my thighs, and then I'm going to lift up on the other side. So first I'm going to, Pavi, we're going to move now. You're going to turn towards this side. I'm on this shoulder. So if you turn towards me onto your back and scoot down the table, please. Lovely jubbly. Good, good, good. And then we get your eyes covered. So I'm using my facial drape to cover the eyes. I'm going to lift the head and bring a little cushioning into the head. And then just add in a little, bring your hands up the person's neck and just give a little tug under the occiput, just to make sure it's a nice long neck. So some people require the pillow, some people don't, depends on what's going on. Some people require more height. So what we're looking for is a nice long elongated neck. And then you can push the shoulders away from the ears. And then as we're changing the bolster underneath, we've got pillows. I'm going to bend my knees, lift her legs, and then drop it down. So my intention is that my person doesn't have to engage their core and lift their legs, but if the legs are too heavy, you can always ask them to bend their knees. I'm sure they'll be more than happy. But ideally, I'm encouraging my clients to just really know that they don't have to think of anything or do anything, and that they can just let all that go for the time that they have on the table. Okay, so I'm going to start on the right leg, my client's right leg. Once I've got the oil on the leg, I'm going to start with 3 effleurages. So I'm going to just start behind the heel. So I'm going to come up either side of the Achilles. The thumbs are just sliding really. You can drop them into a little bit of these muscles, but you don't want to press on the bone too much. But you've got some of those extensor muscles up the side. Skip over the knee and then pressure into the quad. Use your body weight and come back down. Back up we go. Shifting the weight from one leg onto the other. Okay, and then we're going to make our way up. If you like, you can do a little bit into these muscles here with your thumbs, and then come on up over the knee, Drop the thumbs over the kneecap and strip away. So my thumbs and drawing a line and stripping away. You can do that 2 or 3 times. Once I've done that, I'm going to come into the back of the hand again, just like what I did on the hamstrings. Now I'm doing on the quadriceps. Okay, so once I've done that, I'm going to bring my fingers up along the IT band from this side, and then I'm going to make my way into some nice petrissage. Get my hips behind it, nice figure 8, relax shoulders. And the nice ringing. So we're going to close the 3 effleurages. Move on to the feet. So if it's appropriate, you can put your foot up on the table like me. And that is really for my own body. Just have a different position for my own body. Now I can breathe into my own hip a little bit. So I'm just doing some circles around the ankle joint, and then I'm going to bring those circles up the foot. And that's going to lead me into dropping in between the metatarsals. So those bony protrusions. So I'm going to find the little valley, drop my thumb in there, bring it up to the base of the toes. Let's go through there. And then I'm going to just squeeze up along the toes, all the way up to the top. Then I'm going to get behind the big toe and a little pressure point behind the big toe, the base of the big toe. So just above the pads of the foot and the base of the big toe, and then come to the inside of the big toe. Okay, and put a little pressure around the base of the toes. And then it's going to use this part of my hand to do some circles on the pads, and then circle that into the whole foot. And then bring my thumb, and you can just strip along the arch of the foot. It's really nice. Down to the base. Bring that in towards the bottom of the foot as well. It's quite nice. And if you know more reflexology, you can always add that in. It's nice to do some circles on the outside as well. That represents the shoulder in reflexology. Give a little circle around there. Again, you may not want to do all of these, but you could do a few of them. Little mobilization of the toes. So I'm clamping the bottom knuckle, the direction. So I'm doing it from this direction. However, I would probably more than likely have my body over here as a better direction for myself. Okay, that's one leg done, and then the other leg. Okay, so we got the oil all over that leg. And off we go, 3 effleurages. Skip over the knee, and away we go. So in the quad, you'll see more of a chunky muscle in the middle, the rectus femoris, and the attachment is up here. So you might just find that muscle as you're moving through. Bring it over to the IT band. And then into some nice petrissage. Back and forth, relaxing your shoulders and hips. And that's a good way actually to rake through the muscle as well. Get lots of oxygen through it. Separate the fibers. And then the ringing. Finish that up. Three effleurages. Back to the feet. Circles around the ankle. Continue those circles up either side of the foot. And then dropping the thumb between the little valleys. Squeezing all the way up the toes. Along the base of the big toe, which is the reflex point for the neck, and inside the toe, and then just across the base of the toes. A little pressure, and then just get into the pads, using this part, the fingers, or whichever part feels appropriate for you, depending on the size of the foot. You might just want to use your fingers if it's quite petite foot. And then the thumb stripping down through the arch. Into the middle of the foot. Good. If you happen to be massaging anybody who is pregnant, you just want to make sure you don't put much pressure underneath the ankle. There's a few pressure points there. So just nice and gentle is fine, but no major pressure points. Just something to be aware of. Okay, so that is the legs complete. So take a nice deep breath. Just do a little stretch. And exhale out. Good. Okay, so coming back up to the, well, before we do, actually, we'll just do a little stretch of those legs, both of them. Now we can bring yourself up into the arm. Once you've oiled the arm, feel ready, we're going to take the wrist with our outer arm away from the bed, turn it out. So get yourself into a nice position. You see my inside leg is forward into my warrior, and then I'm using the palm to circulate around that muscle, biceps. And then change your body position, bring the wrist in, outside of the arm. Deltoid, triceps, down to the elbow. Sometimes people can get tennis elbow, so it can be nice to work a little bit more into those lower muscles as well. Okay, and then we're going to come up to the forearm. Stripping 1, 2, 3. So if you want nice and relaxing, you don't have to go too deep. You might find that some people really have a lot of tension through there, especially hairdressers, a lot of this repetitive movement. So they may really enjoy a little bit more pressure, but again, just check if they're holding their breath. Remind them to take a deep breath as you do that. And again, you may just hang out somewhere, a little pressure point, working with the breath, and just have to release some of that for them. And then the inside arm. 1, 2, 3. Okay, and then we'll bring the wrist, stack it just above the elbow. Can do some nice circles around the wrist. Then bring it into the, well, circles around the wrist, and then if you like, you can do a little wiggle. Make sure your client's nice and relaxed. So again, this is more relaxing. Swedish aromatherapy, massage styles. Nice to mix it up. By the time you've done the rest of the body, people are usually pretty happy to have their hands done. Okay, so actually before that, let's go down through the little valleys again. So this is the metacarpals, and then each knuckle, little circles, little squeeze up the finger. Okay, and that's our arm done. And again, if you're looking for a nice relaxing way to do that, it's been quite a pampering experience for a person. If you want to give them that more day spa pampering experience, nice little feather touch down the arm is a nice way to end it. Bring the drape over, and then you can just from either side of the elbow, just come up to the shoulder and to the wrist, and just a little pressure, not too extreme, and then gently off. And then the other arm. And we do the same thing all over again. Do you want to come in to see the next piece? We're doing the neck. Yeah. It's okay. It's just for the training portal. We'll put you on massage TV. Who knows? Could be the new latest meditation. People can't sleep, put on massage TV. Okay, so you oil the arm up and then take the wrist. You can come in as well. Yeah, just go over in this corner. Yeah. So just find which way. Depends. Sometimes I go this way with my warrior and sometimes this way, but just find one way that works for you. Allow my body to come behind as I move through the bicep or the tricep. Feel the deltoid, down to the tricep, and maybe a little bit just above the elbow. Especially if somebody has tennis elbow, they'll have some tight, generally muscles up there. Okay, and then into the forearm. So sometimes as I'm stripping down somebody's arm, I'll just notice that they hold their breath or something. So that's, I may feel the tightness, but also I often notice they might hold their breath. So then I would just remind them to take a deep breath. And I'd hang out there for a little bit more, maybe add a bit of pressure on the exhale. Again, if I was making it a bit more deeper pressure, deeper tissue. So yeah, sometimes people do ask for their forearms, especially hairdressers and people who really use their hands quite repetitively, very tight forearms. Even massage therapists actually can get quite tight forearms depending on how they're, especially if they're using the hands a lot. We have one treatment that we offer at Vibrant Living, head, hands and feet. So sometimes people just come in for that. So we spend 45 minutes, 15 on the feet, 15 on the head, 15 on the arms. And then 3 on the inside. So using the base of the palm, clamping the wrist, then clamping the hand, a little wiggle, optional, and then into the palm, the thumb. Base of the thumb, then up, just covering the whole palm really. Find the little valleys, coming up each little valley in between the metacarpal, the bones, and then coming back, moving up each knuckle, little circles, little squeeze, circles, circles. Now if you're running out of time, you could just do this a lot quicker, but if you have the time with the person, it's so lovely to be able to give this extra attention to the fingers and the knuckles. Especially people who work with their hands in the soil, or older people with arthritis, just a bit of joint pain and issues. Okay, and then a little feathering to complete. One hand on the wrist, one hand on the shoulder. So we start either side of the elbow, smoothing down, a little pressure and release. Okay, keep my hand with the elbow, the shoulder, coming up into the neck. So I want to cover just the upper chest and around the shoulders, up the neck. So you may like to get a chair for this part. I sometimes go between standing and sitting, depends. come onto my knees for today. So I'm just getting the oil. So this is like the effleurage. And in under, up the traps, in under the neck. Across the pecs, the chest, round the shoulder, in under the traps, back up the neck. A little tug under, just a little one. So you can do that about 3 times, is really nice. And then on the next time, what I'm going to do is just bring my hands under a little bit more. So everyone feels a little bit different. So, because you can't actually see it so much, you might just need to feel it. So I'm just getting my hands in under. And what I'm doing is I'm feeling the spine. The spine is in between my fingers, especially these ones. And I'm pulling along either side of the spine and press them, allowing, what's lovely of getting the hands in under and this position is the body weight. So I'm just pressing my fingers up either side along the spine and out slightly. That's it. So she's naturally taking a breath, but it is nice to invite that breath as well. Inhale and exhale. Now, usually the tightness is around the upper shoulder or just inside the scapula bone. So you may just feel some there and usually either side of the spine up into the neck. Just do some nice circles. And different people, I use different things. So I tend to be using my fingers at the moment. Sometimes I'm using this part, kind of this part, depending on the person. So you'll have to just find what works for you, depending on the person on the table and the space that you have to work with, what feels appropriate. Okay, so I'm going to put my hand on my person's forehead and just tilt to the side. So Pavi's going to tilt. So Pavi tilted her own head there, but actually what I'm going to say is, say you go to tilt somebody, maybe they've had some neck issue or whiplash or something, so they're not too comfortable with just moving their head. So then you can just ask them, okay, so if you could just turn your head over to the left as much as possible. Sometimes you can just feel the resistance that they haven't allowed you to go over. And then so we're getting into the neck muscle. So just behind the ear, you can see it just at the top of the collarbone, top of the sternum, where the sternum and the collar connect, is where this muscle connects, the sternocleidomastoid, so SCM. And so sometimes you can see it really clearly. Sometimes you kind of have to sink in your fingers, just have an idea where it is. If you have an idea that it's, if you go to the collarbone, clavicle, it's going to come up behind the ear. So you just don't want to go over that really. You're just sinking in behind it. Because if you go over it, you can kind of start getting to the vocal cords and yeah, it's not so nice. So we stay behind that muscle and get into the scalene muscles behind it. Just do some nice circles. That's really nice. Okay, so a nice stretch to do is to bring one hand just under the top of the neck and then get our client to take a nice deep breath and pull, glide down with the thumb all the way down to the shoulder, and you're kind of pushing the shoulder away. So I'm pushing the shoulder towards the feet and I'm pulling, I'm just kind of clamping and pulling kind of in the opposing direction. So take another deep breath. So with the exhale, I'm going to go for that last bit of push. For some people, you know, especially if they have a lot of tightness there, working at a job, that can be a big stretch for some people. So again, nice deep breath. Good. Also, what can be nice when the head is over on one side is just to go down one side of the spine, and with one side, sometimes it's easier to go down a bit more. So there should be oils. You've done the back. I'm going to just come up there. or it doesn't have to be quite that low down. And then it's quite nice just to do some nice circles as you're moving towards the scalp, underneath the skull, and then we'll do it on the other side. So if I feel quite comfortable with my person, or that I feel like they're feeling comfortable with me, you can take their head and just really lift up and take it over the other side. Or as I said, you can just ask them. Just be careful where you put your hand. So I usually aim for the third eye, where my finger is. So just make sure they're not on the eyes. And just the same thing on the other side. So I'm looking for that nice SCM, sternocleidomastoid, that big muscle, getting in behind it. Getting some fingers just in through those shoulder muscles, the traps. Just depending on where the you feel the tightness is. For Pavi, I definitely feel it up there. Let's take another deep breath. So think close to the spine, just coming up to the cervical. Yeah. Okay, and another deep breath. So I'm going to hold the top of the levator scapula and pull the shoulder away. So again, another deep breath. And one more. Just do some nice circles at the base of the skull. Okay, and then come on back into the center. And then we can finish with some nice effleurages around. And you can do a little pull-up again, either side. And bring it all the way under the occiput. When you're doing that one as well, it's good to just lift one hand and then the other. So you just keep that nice contact. And then pull it up in under the, and then we can cover my person, who happens to be Pavi today. He'll be going off to massage somebody else soon. Okay, and I'm going to get, so to finish this off, to bring yourself up into the scalp, I'm going to get my hands in under. So sometimes it's going to be easy and not. Sometimes people aren't comfortable with really giving you their head to rest in. So it can be a big ask. So sometimes if I really notice that it's a challenge for somebody to actually keep breathing while I'm holding their head, then, you know, that's fine. So I get them just take a nice deep breath, and I'm looking to tilt up their head slightly, and then on the exhale, pull back. So inhale and exhale. Inhale and exhale. If you can, get your fingers in under. So just be aware if you have oily hands, and just check in with the person if they don't mind oil in their hair, if your hands are very oily. Or actually I use this sometimes. Just do the massage over. And this is just some nice circles. Just nice and simple around. A little bit on the skull. That's really nice. Just a little bit to add at the end as we finish up. Okay, I'll take that off for now. So just be aware of the light. So if there's a bright light, then just be aware if they're under the darkness for a while, it's going to take a while for the eyesight to adapt. So just put my hands over, just with that awareness, until it gives them a few moments to adapt. And then just bringing my fingers down from the top of the nose, and just moving into that little place, our little frown lines. It feels really nice to release and relax. You can just do some circles, maybe into the temples as well. And if you have more time, just go into the scalp. And your person is okay, they're not worried about oil. Otherwise, you can just take the oil off with a towel or wash your hands. Okay, and then to finish, so I'm going to bring one thumb onto the third eye energy center. I'm going to bring my middle finger to the top of the crown. And I'm going to bring my hand to above the heart, or just where the heart. You could just use the fingers. So you just find that might be too much. So maybe just the fingers over the heart area. So these are the different energy centers. So I'm going to finish with 3 breaths. So often I'll say to my person, okay, so just take a breath to complete and integrate deeper into the body. That's it. Good. Couple more breaths. Breathing in. Sometimes I put my hands on the ribs, is really nice to encourage that expansion of breath. And then a little rocking side to side. If you find that a little challenging, you can just walk back down the body. So it doesn't have to be. That's it. You can do it again. And with this, the intention is to really imagine the flow of energy just coming out through the body, just completing back to the feet. And because we've been up and we've pretty much finished at the head, I like to get people back on their feet. So take another deep breath and exhale out. That's it. Another deep breath and exhale out. Good. And a little pressure, top of the toes, nice, which responds to the brain. A little pressure there. Okay. So I'll just go back to that part. So you can either do a little wave. So I'm bringing my hands down the center. So they're taking that breath. So maybe I'll just show you it again. So forehead, crown of the head, the heart center. So that's the first breath. Second breath. The ribs, I'm encouraging that nice deep breath up and around, and then I'm going to start my wave. So it's just a little rocking, and then softly around the knees. It's a little circulating, little circle. If somebody's had a knee operation, just go very gentle. Might be very gentle. It may just be, just a nice kind of reaffirmation. The knees are about flexibility and adaptability, feeling supported. And then bring it down the feet. And with that intention as well of flicking off and disconnecting from your person as well, that you've completed, or once you've done the feet, you can just have that sense, or even if you don't do it off the body, just once you've finished the feet, you've done the stretch, just make sure to find some way to flick, and that's your disconnection. Or even if you do this, I do flick, disconnection, yeah? That's complete with that person. So yeah, so just finding your own way to disconnect energetically is really, really helpful. And to really honor that connection and relationship. If you don't honor, I have one therapist who worked with me, and she was actually getting a lot of skin issues because she wasn't really getting this connection that she had. So it was like she needed to get the skin issues until she would start learning to disconnect and realize how energy sensitive she really was, and that, understand that there is really a communication and a connection. So when she started doing more of the energetic stuff, the skin issue went away. Yeah, it's pretty cool. Okie dokie. Thank you very dearly, Pavi. Wonderful client.
Thank you.
I know it was tough work.
Oh, yeah.
You hung in there though.